The Office of the Health Ombudsman investigation into Stewart Kelly's death at Robina Public Hospital was released on the 4th of February 2026 and identifies systemic failures at every point of service within Gold Coast Hospital Health Service. Stewart Kelly was a 45-year-old autistic man with no previous medical history who complained of abdominal pain. Family observed changed bowel habits, and then Stewart stopped eating and drinking. The medical investigation conducted as stated to be an X-ray, bloods and urine, which the report states excludes all medical causes for Stewart's abdominal complaints. From this point forward, Stewart was labelled behavioural and mentally ill. That's a problem, and any medical professional should see glaringly. There was no true investigation of his original medical complaint, and the tests conducted do not exclude all medical causes. There was no CT, no MRI, no scopes, no extended testing. The hospital did not do a thorough medical investigation, nor did they engage in the support methods the family and support workers requested hospital staff use to best engage with Stewart, or refer to any specialty outside of psychiatry prior to Stewart's final days in the intensive care unit. Where was the gastroenterology referral? The Office of the Health Ombudsman conducted a root cause analysis and sought clinical experts in psychiatry and allied health, inclusive of an eating disorder specialist. Where is gastroenterology and neurology? The clinical experts identify that folks with autism are more susceptible to psychiatric illnesses like depression, anxiety, and eating disorders, however, doesn't consider the concurrent medical conditions autistic folks are also more likely to experience: gastrointestinal, vascular, cardiac, renal, connective tissue, and neurological. Stewart Kelly was an autistic man complaining of abdominal pain. If Stewart were a neurotypical man, he would have been referred to gastroenterology. Why wasn't Stewart? The OHO investigation recognises failures across all points of service within Gold Coast Hospital Health Service, yet only one staff member has been recommended to AHPRA for possible disciplinary action, and we don't know if they are a junior or senior staff member. Senior staff are responsible for setting culture, and that includes cultural attitudes that maintain eugenic systems, like that which resulted in the starvation death of this 45-year-old, 110-kilogram autistic man. Gold Coast Hospital Health Service has a culture problem, and that resulted in record numbers of people detained under the Mental Health Act in Gold Coast hospitals. This includes other neurodivergent people like Stewart Kelly with untreated medical conditions which cause behaviour changes. Gold Coast Hospital Health Service senior clinicians have tried to force eating disorder labels on other neurodivergent patients, even after knowing the structural medical cause of their malnutrition. This is not a single staff member issue, it is structural eugenics that junior staff are forced to comply with to maintain their employment. Gold Coast Hospital Health Service have been directed to improve staff awareness of compliance requirements for responding to patient deterioration, and in 12 months' time are to provide a report to the Office of the Health Ombudsman on Gold Coast Hospital and Health Services progress in operationalising the Queensland Health Patient Safety Net initiative and rollout of the clinical safety escalation pathways for nursing and midwifery. There's other recommendations as well, but it's disappointing the Office of the Health Ombudsman took 4 years to complete this process, and in that time frame has been rejecting and closing similar complaints from other patients about the same hospital health service and the same types of behaviours. I dream of days where more healthcare workers speak up and hold their senior clinicians responsible, because that is who is responsible. You can read the full report available on the Office of the Health Ombudsman's website. Thanks.